Strokes can occur at any time, but did you know there are specific factors that can contribute to the onset of a stroke? Dr. Hassan is here to explain and tell you what you can do to help prevent this. Dr. Hassan, thank you so much for being here this morning.
My pleasure.
So let's go ahead and go over some of the symptoms first of an actual stroke.
So basically, the biggest signs are face weakness, arm or leg weakness, speech difficulty, and if you have any of these signs, you should basically call 911 immediately.
Okay, and we talked about this when I was there visiting you. There are actually specific factors that can increase your chances of having a stroke, and specifically one that affects a lot of people here in the Valley.
Yes, so the biggest risks of acute ischemic stroke in the Valley especially are hypertension, diabetes, which are extremely relevant here, and it's most likely related to genetics and diet, but it's the number one thing we have to try to tackle here in the Valley. We want everybody to go to their family practice doctors, take their medications, try to change their diets, a little bit more exercise. All these little things can increase your chance of not having a stroke and having better outcomes if you do have a stroke.
When you visit your doctor and you know that maybe you're predisposed to a gene of having a stroke, what kinds of questions should you ask?
Well, basically, the biggest issues are usually, again, like high blood pressure and cholesterol. So if you have family history of high cholesterol, heart disease, or any of these, your doctor will probably check some labs and prescribe the right recommendation, medications, and so on before he lets you go out. There's also antiplatelet therapies like a blood thinner like aspirin or Plavix, just to help you prevent having an event.
And once you're actually in the event, what should family members do? I know that it's scary, it's kind of, you're in the moment, so what should family members do if they suspect that their family member is having a stroke?
Well, stroke is an emergency, and that's the one message we want to get across. Immediately call 911, get to your closest primary stroke center, and then depending on where you live and what you have, they'll transfer you to us if you need that comprehensive care.
Great. We want to thank you so much for being here this morning. You've been so helpful, and of course you can catch that story and this interview on valleycentral.com. We'll be back in just a moment.